If I say you that electrocardiography or ECG records electrical activity of the heart, it does not record or it cannot assess structural activity of the heart. We can only predict that this electricity can cause this structural change in the heart, but this electrical activity does not translate into a structural change in the heart. So you will think that what is the new thing in that? I already know ECG, as the name itself implies, it is electrocardiography, so it records electrical activity. So why are you telling me? I understand this, but if you are understanding really, then congratulate yourself, because I do not understand. Even I have lot of information, I read lot of information, I do not understand them. So I have little understanding, lack of understanding, but let's now come back to our topic. So what is premature atrial contraction and what is premature ventricular contraction? What do you understand by that? So atria is contracting prematurely and ventricle is contracting prematurely. So can you assess whether atria is contracting prematurely or ventricle is contracting prematurely from ECG? So contraction means a structural change, right? And ECG is recording of only conduction system. It is only recording of depolarization. So if there is depolarization, it does not mean there is contraction in the heart. Are you getting me? If the amplitude of contraction is not crossing the threshold voltage, it won't cause contraction. It will only be depolarization, right? So I will call this premature atrial contraction or premature ventricular contraction as misnomer. You cannot tell premature atrial contraction. It may not translate into contraction. It is premature atrial depolarization. Right? So if there is premature atrial contraction in ECG, it does not premature atrial depolarization in ECG, it does not mean that there is premature atrial contraction in the heart.